Welcome back, 224 students. Would you like the good news or the bad news first? Let me hear. Oh, the bad news. I don't even have to hear you to know most of you probably would prefer the bad news first. So the bad news, there's a lot of stuff in today's lab, lab number 8. The good news, it's lab number 8. This is the last new information we have for this academic semester. And fortunately for us, there's no physiology experiment to worry about, no data to collect in today's lab. It's all naming things. So what we have is the endocrine system and the reproductive system. For each, we have anatomy and histology. So we will have the anatomy pointing at some endocrine glands, just naming them. This is the pancreas. This is the thymus gland. This is the thyroid gland, like that. Then some histology that you can see in your lab manual that I'll take you through right here on the big screen. And the histology for endocrine glands isn't too terrible because each gland looks differently enough from the others that you shouldn't have too much trouble with it. Then we have the reproductive system, both female and male anatomy and histology. Now, what you have probably noticed already in your lectures, if you have not, let me point it out to you here in lab. And man, is this ventilation system loud today. I think somebody knew this was the last lab for us and they just really cranked it up. Do you really think they would do that to old Professor Allner? I don't know. But hopefully my trusty mic here is picking up my voice enough so I'll provide you with the best audio quality that I am able for today's lab. But getting back to it, what we have here are a few structures. The testes, the ovaries, the pancreas would be good examples that are dual function organs. The pancreas, we saw in lab number 6, that's a digestive organ. It's also an endocrine organ. We'll see that today. The testes, making testosterone, making inhibin, it's endocrine, but it also produces sperm cells, which makes it reproductive. Ovaries, estrogen, progesterone, inhibin, and producing oocytes. So dual duty for these organs. So you will see the pancreas here in the endocrine system. And what we will do is just discuss the testes and ovaries once. That's in the reproductive system. So the format of today's online lab, we'll go through the endocrine system first, anatomy, then histology, then proceed to the reproductive systems. Hopefully this lab, when you see it, the timing in the semester, will help you out in your study of the endocrine system and the reproductive systems for your lecture test. But again, this is the last new stuff for this semester, so buckle up and let's start on endocrine anatomy. So let's begin our look at the anatomy with these two plaque models right here, sort of wall mountable plaques of the endocrine system. Now I want you to understand the same exact rule applies for this last lab of the semester as has applied for all the others. Anything I show you here in the instructional video or in the practice video is fair game for your lab quiz or after that our practical. If I don't show it to you here, I cannot ask it. Now these two plaque models are pretty good, but they are by no means perfect for the endocrine system. Let's take a look at these two. I'll zoom in on them a little bit and then show you some of the same structures on other models. Because if you have your lab manual handy, open to page 1, which is where mine is, right there, have a pen or a pencil ready and check off, mark off the endocrine glands as I go through them with you, so you can see them on this plaque or on the other models. The ones that we have very few examples of, I would say, are probably the parathyroid glands, and I put that in air quote, glands, that we have, and the thymus. But we can find many of the structures here in these two models. So let's start taking a look. So first, look at this one close up, and notice that we have a human figure here, and then isolated glands spread out on this particular model. Also notice, if you will, that these glands actually have their names written with the glands. Obviously, if I was to use this one for a quiz or a practical, I would blank out the names that are printed on it. So don't think, oh, I hope he uses that one because it's got the name written right there. Oh no, I will block out those names. But let's start over here. So we do not have a pineal gland worth anything on this particular model. We do have a hypothalamus and a pituitary gland right here. The hypothalamus really in charge of everything, and the pituitary gland sitting below this little knob right there, and we'll see several examples of that. In the person's throat, directly in front of the thyroid cartilage, we have this butterfly-shaped thyroid gland. Here it is larger. So always look for that thyroid gland to be shaped rather like a butterfly, living right in front of that larynx or voice box. As we move our way down, no thymus here. I've only got one model in this entire lab that shows us a good thymus gland. And notice this one does not really even have a good parathyroid. Oh, they tried to label it right here, but that's not good. I'll show it to you on the next door model better. Just above the kidneys, you've seen these before, the two adrenal glands. The looks like scrambled egg right here, pancreas. Notice the adrenal gland and the pancreas right here. And then as we continue down, we would have ovaries and testes here, which are also the dual reproductive organs. So this model right here is not terrible. I don't think it's quite as strong as this one next door. But again, notice thyroid, pancreas, very typical looks here. Let's move to the other plaque model, which is a little better. So if we examine this model, first looking up at the brain, I can see the pituitary gland right there. Let me zoom in, and trust me, I have other views of this also. So here's a perfectly good pituitary gland right there at the tip of my pointer. The hypothalamus, the lower portion of the brain's thalamus, is right above that. So pituitary gland and hypothalamus. And I can see right next door, right there, an enlarged pituitary gland. So think back to Bio 223, remember that infundibulum, that little stalk? This is a pituitary gland. Now before I leave it, just to help you out with the histology a little bit, I hope, notice that the anterior portion of the pituitary gland, which tends to be much larger, and it always takes more stain. It's more colorful, it's darker. These are typical glandular cells derived from epithelium, and epithelial cells, man, do they love to take stain. So you can always recognize the anterior pituitary by the fact that it's bigger, takes more stain, more colorful. The posterior pituitary back here in white is essentially the axons and synaptic terminals of neurons that started up above. It doesn't take much stain, and it's smaller. So posterior pituitary, anterior pituitary. Remember that when we look at the histology. For this anatomy portion, if I pointed at this thing, you would just say pituitary gland. If we move down into my sort of fictional person's neck here, I can see that butterfly-shaped thyroid gland right in front of the voice box, even larger right here. So always look for that thyroid appearance. Thyroid gland looks like a butterfly. And then you have to use your imagination a little bit, because this is the only model we have that shows this well. If I took this thyroid gland, tore it off the model and flipped it around so we could see the posterior side, the reverse side, that's the model I have right here. So this is the posterior surface of that thyroid gland, and I can see these nodules right here, which are my parathyroid gland, collectively referred to as if it's one structure. So these are the structures that make PTH, parathyroid hormone. You might remember the bone breaker from first semester. The thyroid gland makes thyroid hormone, T3, T4, this is lecture stuff for you, as well as calcitonin, you might remember. So it's these nodules right here that can only be seen on the reverse side, the back side of the thyroid gland. These collectively are called the parathyroid gland. This is the one and only view I have of those structures that's any good at all. This one right here. Parathyroid gland.
Next up we have what in this model passes for the thymus gland, but this one's not without some controversy. Some say it's thymus, some say it's not, some might even call it a thyroid gland. So I suggest you check with your lab instructor. Do they say it's the thymus? If they don't say something either way, you should say it's the thymus.
But as I go down into the abdominal cavity, what can I see? A pair of adrenal glands. I can see an isolated one right next door. And just again, to maybe help you with the histology, look at this triangular shaped adrenal gland. There we go, that's not too bad. Notice this gland has a cortex and a medulla. The medulla is characterized by having these relatively large blood vessels in it. The blue ones here are medullary veins. Remember that when we look at the slides. That will help you identify it. The cortex out here is where we make those steroid hormones, the androgens, mineralocorticoids, glucocorticoids. That's lecture stuff for you, so hopefully that'll be a bunch of fun. The medulla is actually a collection of postsynaptic sympathetic neuron terminals that release epinephrine and norepinephrine right there in the medulla. But look for those blood vessels in the medulla, the middle part of the organ, as the characteristic that will tell you you're looking at it in the histology section. So again, right here, a nice view of adrenal glands, and this is the pancreas. Looks like a mass of tan or yellowish scrambled eggs to me. All you have to know is pancreas from these various models. What they show me just to my right, this thing is supposed to represent one of the pancreatic islets. You remember those from lab number 6. Those are the things that will give away this organ to us in the histology. Remember, this is me wagging my finger at you. Remember, for the anatomy section, look at your lab manual, all I can do is point at one of these things. Name the organ, pancreas. Name the organ, adrenal gland, like that. So keep that in mind as you're prepping and studying for this lab quiz. The histology I can get a little more detailed in, but the anatomy section, just name these organs. And we can't see them all on this plaque. So we have to use some of our other models. So here's that trusty old 3/4 size human model I have here in lab. Hey, how's it going? And we're looking into the thorax of this model. I think you can notice the lungs from lab number 5, the diaphragm and so on, but we're not looking at any of that stuff here. All I want you to see is this thing. This is the thymus gland. And you might remember from our lymphatic discussion back in lab number 4, this is the one and only model I have in this lab that shows me a thymus gland. So here's the thymus gland responsible for making thymosin hormones right here. Very large in this model, wouldn't really be that big in most people, but thymus gland, the only view you will see of it, the only way I can ask it, right here. Now you see a couple sagittal heads, and I need to show you probably a little better those endocrine structures that are in your skull. So let's start with the one on your left. I will zoom in a little bit. Right there would be good. This is a perfectly good picture. So I can see, just by way of reference, my vertical vomer, my perpendicular plate of the ethmoid, the sphenoidal sinus, you know, all that fun stuff. But I don't want to see any of that. What I want to see is a whole bunch of structures associated with and very near your brain's thalamus, right here. So first, look very closely, watch the tip of my probe. This pinkish structure right here, ending in a knob just above the midbrain, just above that good old corpora quadrigemina, you might remember. This thing right here is the pineal gland. The pineal gland. In the upper and rear portions of your thalamus. Right here where the tip of my probe is, this is the hypothalamus. I know you've seen that before. And right below the hypothalamus, nestled in that sella turcica of your skull, there's a pituitary gland. Perfectly good view right here of those structures. Let's just slide over to this model. Again, notice sphenoidal sinus. Here in pink, the pineal gland. Not this red and blue thing, that's a choroid plexus from Bio 223. The pineal gland right here. Hypothalamus right here where my probe's wagging around. And then here's that pituitary gland. And this model even shows me a little infundibulum, that little stalk that the pituitary gland hangs on. So pituitary gland, hypothalamus, pineal gland, well represented here. Here's just another sagittal head, and I think you can see the same structures. So follow along with me. Pituitary gland, hypothalamus, and then see in pink, they almost always make it this pink color. This is the pineal gland. I could also see those same things in this skull. So notice the sella turcica here. There's that pituitary gland. Hypothalamus. In pink, pineal gland. Very nice model here. Hypothalamus, pituitary, pineal gland. Now let's look at a couple of the torsos we have in lab. Remember this guy with that nice external jugular? Notice the thyroid gland right there. Beautiful thyroid gland with a nice, superior thyroid artery. I say this just to irritate you because it's fun and it's my last chance. So, thyroid gland. Let's go down into the abdomen, see what else we can see. if I pop out the liver and the stomach, look at this. Here is a pancreas. Remember that pancreatic duct sort of gives it away on the models. And 2 adrenal glands. Look at this model. 2 adrenal glands. When you see it in this view, you sort of understand why an attempt to rename these glands has sort of been underway. People trying to call these things the suprarenal glands. But adrenal is still the most common name, so that's what everybody goes with. Adrenal gland, adrenal gland. Let's come over to this last torso right here. Let me do a little gutectomy here. And I think you see the same pattern played out here. Notice the pancreas with that pancreatic duct, pancreas. And then behind, adrenal gland, a little more gut removal. And you can maybe see them a little more clearly. Adrenal gland, adrenal gland. So, anatomy of the glands is just naming them. So practice that a little bit. Okay, everybody, let's start taking a look at some of this histology. Now, there's a lot of it in lab number 8. So be careful, watch this instructional video a number of times, as well as the practice video, to really get these tissues down so you can answer questions that fast on your quiz or practical. I will try to create the best images I can for you. That's my job. Your job, go over and over these things and try to learn them as well as you can. So first up here we have a picture or a micrograph of a thyroid gland. Notice first, to me at least, the appearance that we have here is that of an aerial view or a satellite view of a whole bunch of lakes. I'm from the upper Midwest. I know the nickname of the state of Minnesota. It is the land of 10,000 lakes. That's why the basketball team in Los Angeles has the name they do. It's not an accident, sports fans, that the colors of the Minnesota Vikings and the Los Angeles Lakers are the same. And in case you never noticed, there's not a lot of lakes in Los Angeles. The team started in Minnesota, then they moved, they just kept the name. Minnesota has lakes everywhere. As soon as you see this appearance of all these ponds or lakes, this is the thyroid gland. If I jump up in magnification just a little bit, we can see these structures you are responsible for with the thyroid gland. So what do I get to ask you? Name this organ, thyroid gland. Again, notice the ponds or lakes here. Each one of these lakes is a follicle. And the fluid inside them, sort of a thick fluid-like material, this is called colloid. So this is colloid. That's colloid. That's colloid. One of the things I could ask you, I could put a dot right on it and say, name what the dot's on, colloid. The follicle cells are the cells you see right here that form the, I'm doing air quotes here, shoreline of this lake. Those are follicle cells. So follicle cells are the shoreline, colloid is the water, if you will, in the lake. Any cells that we see that are not part of a follicle, look everyone, right here, this grouping of cells. Right here, that grouping of cells. Those are called parafollicular cells. They are around a follicle, but they're not follicle cells. So one more time, what's the organ? Thyroid gland. They all look just like this one. Colloid, follicle cells, parafollicular cells. Parafollicular cells. Parafollicular cells, they're not part of a shoreline. Here's some down here too. The thyroid gland. Now, a little lecture, because I know you love it. This colloid, that's where the T3 and T4 molecules are being formed. The parafollicular cells, they make the non-thyroid hormone stuff like calcitonin. So this is where your thyroid hormone, T3 and T4, is in this colloid, inside a follicle. So again, thyroid gland. Right here we have what, in my humble opinion, as the guy who spent a long time looking for this thing, a very, very gorgeous pituitary gland micrograph. Very, very nice. Why do I say it's so nice? Well, I can see the three parts of it very easily because they're differently shaded. Notice this section, the darker, this section, mid-range, and this section, much lighter. These are the anterior pituitary here, posterior pituitary here, and intermediate pituitary right there. You may or may not talk about this particular section in your lecture, depending on whether your instructor wants to talk about hormones we still make a lot of as an adult or not. I'll just leave that one hanging there so you can figure it out. But these three regions are formally known as pars distalis, pars intermedia, and pars nervosa. Look at those three terms in your lab manual. So what can I ask you? Name this organ, pituitary gland. Pars distalis, anterior pituitary, pars intermedia, the middle section, pars nervosa, the posterior pituitary. A little helpful hint for you to maybe understand this histology a little bit. Remember what I said in the anatomical section. The anterior pituitary is made of typical glandular cells, epithelial in origin. It stains darker. The posterior pituitary is just neurons coming down from the hypothalamus. Doesn't take much stain. Neurons, the nervosa, lightest. Posterior pituitary. Posterior pituitary, anterior pituitary, intermediate. Pars nervosa, pars intermedia, pars distalis. A beautiful, beautiful pituitary gland. I got to tip my, academic hat to whoever the technician was who made this thing, because they did a fabulous job. What we have here is a slide of a pancreas. Now, we already saw this before, way back in lab number 6, which wasn't actually that long ago. I prefer a slide like this that's stained pretty dark, and by extension, since you're in an online lab and you don't get a choice, you prefer a slide that is dark. And the reason I like this slide is because it shows me quite nicely, look here, 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 pancreatic islets. The lighter portions in the staining here, these are the endocrine sections. Think insulin and glucagon here of this particular organ. So you might see lots of things that look like this, but you have to see these islets for it to be a pancreas. Let's take a quick look at it in higher magnification. Once you start seeing islets like that one, pancreatic islets, it must be the pancreas. So as soon as you see pancreatic islets, this is the pancreas. So what can I ask you? Name the organ, pancreas. Name the structure, pancreatic islet. That's all I can ask you from this one. Okay, here's our last endocrine slide. I think a pretty nice version of an adrenal gland, says the guy who spent the time finding one for you. So yes, nod at home with me. Yes, this is a very nice one. Thank you, Dwayne, like that. The reason I think this is nice is because in the adrenal gland we have several structures that you are responsible for being able to name. First off, out here we have the capsule of the organ. That's pretty easy for you people by now, I hope. Then we have this very solid looking section. Notice 3 colors, 1, 2, 3. This is the cortex of the gland. And then notice here in the middle where I see these rather large veins, this is the medulla of the adrenal gland. These things are actually referred to in the biz as medullary veins. In fact, in this one I can even see some red blood cells in there. So I can very easily distinguish the cortex right here from the medulla right there. And in the cortex we have 3 zones or areas, each responsible for producing a different group of hormones. So start with me on the outside here. We have the zona glomerulosa, the darker one. In the middle, lighter, the zona fasciculata. And then furthest in, right here, the zona reticularis. And they show up quite nicely in this particular slide. So again, capsule, zona glomerulosa, zona fasciculata, zona reticularis, the 3 parts of the cortex. Where the veins are, this is the medulla of the organ. So again, I think a pretty nice view of an adrenal gland. I don't think you will find a better one anywhere in this video. Now we will begin our examination of female reproductive anatomy. And I want you to notice as I pan by, I've got a good number of reproductive models that we can look at. I won't even attempt to show you all of them. I've got so many, but the views are essentially the same. We have frontal and sagittal views, and remember, for lab, all we're doing is going through the anatomy, naming these parts when we see them. So we're on page 2 of your lab manual. Follow along with me right at the top, and we start with, in our list of about 41 things, I think, if I counted correctly, the mammary glands, the breast. So what we see here are a couple models of mammary glands. Pretty straightforward. People seem to like this model right here, I think just because it looks a little more normal color-wise, but it isn't that great. We can see a few things here with me. So notice first, we have the nipple and the areola. Areola meaning going around the nipple. So the mammary gland, nipple, and areola. I have the same exact things on this slightly older model. Mammary gland, nipple, areola. Now people often wonder, is the breast fat and a gland or adipose? What is it? The answer is yes. It's adipose and an exocrine gland. So when I open this model up, I can see all of this yellowish adipose. So I could ask you that tissue from this particular model, what's this, what's this, what's this? Adipose. What we see here in this sort of violet color, this is all the glandular part of the breast. Each one of these small structures is a lobule of the mammary gland. These black lines represent lactiferous ducts. The sinuses, the lobe, we can't see quite so well on this particular model, but I can see the adipose, individual small lobules, and lactiferous ducts there pretty nicely on this model. But if I want to see lobes and lobules, this model is better. So I'm going to turn this model, but before I do, just a piece of general info, and people ask questions like this all the time in the reproductive lab. If you can't ask your anatomy professor, who the heck can you ask? Notice in green right here, what structures do we typically see in green, sometimes white in these models? Lymphatic structures. Sure. These green things are lymphatic vessels and small lymph nodes. This is one of the dangers of breast cancer for women and men too, because we can get it. If one of those tumor cells was to get into the lymphatic network, remember that's a vascular system, this is one of the dangers of metastasizing breast cancer. So, self-exams, early detection, you'll hear about in your lectures, that's always what we want. But if we focus in on the yellow structure, so this yellow structure right here looks like a bunch of grapes. This is a lobe. So a bunch of little lobules. Here's another one. This structure right here is one lobe. Each individual grape in the bunch of yellow grapes I see here would be a lobule, little lobe. Then notice right here and right here where the duct bulges out a little bit. I'll do my best with my camera work here. Sorry if it's blurry for a second. So notice the lobe, individual grapes, lobules, and then the bulge right here with the number 854 on it. The bulge right here, these are lactiferous sinuses. And the tubes that I see here are called lactiferous ducts. So in white, I have the sinuses and the ducts. Now notice multiple ducts. This comes as no surprise to someone who has breastfed before, but some people are amazed to discover, believe it or not, that when milk exits the breast, it comes out of several holes, doesn't it? You wouldn't believe how many people think that milk ejection is just one stream of milk coming out, you know, like you're shooting a squirt gun or something. That's not the way the breast works. Multiple ducts, multiple openings for milk to be ejected. So this model shows me lobes, lobules, sinuses, and ducts, as well as a little bit of adipose. This one does not really show me lobes well. It does show the adipose well, lobules, and lactiferous ducts. The sinuses that I can see here, a little weak. They should be a little bigger, more expansive. A lot of the reproductive structures we will see, male or female, look sort of like this one, sagittal sections that happen to come apart. But a couple of our next structures we can see very nicely on these sagittal sections. So you see listed on the left-hand side of page number 2, the symphysis pubis, which is the formal way of saying the pubic symphysis, which you of course have heard of before. I can see it very easily on these sagittal models if I remove half of it. So see this blue structure right here? You know, you have to imagine that our patient, she's facing us. This is that fibrocartilage pad between the two pubic bones, this is the pubic symphysis. And right in front of it, we have this little collection of adipose that lives right here. This is called the mons, or the mons pubis. So these pubic structures, pubic symphysis and the mons pubis right there. Very easy to see on all of these models. So again, just remove this. Why do they like to make these sort of blue? Because it's fibrocartilage. They want you to think of cartilage. So the pubic symphysis and the mons, or mons pubis, right there. I have one more sagittal view. This one, I can see exactly the same structures, pubic symphysis, mons pubis, right here. This always helps orient us to the anterior side of the person. So this pubic symphysis, sonography people, sometimes you'll use that as an anatomical landmark for taking urinary bladder pictures and things like that. Right there under the mons. Mons pubis, excuse me, pubic symphysis. We can also see the labia here in this particular model. So just to orient us a little bit, this is the urinary bladder on this particular model. Look at this, they stuck some urine in there. Here is the urethra. The clitoris, right there, erectile body in females. Corpus cavernosum tissue, right there. And these two structures here are the labia. Labia major or majora, if we're being a little more formal, and minor or minora there. Labia major, labia minor. This tube, the posterior one, this is the vagina, right here. So, working my way back from front to back, the mons pubis, clitoris, anterior structure, anterior to the urethra, clitoris, labia minora, labia majora, urethra, vagina. Looking at this sagittal section. Let's keep looking at the other sagittal sections. You'll see the same exact structures in the same exact order. Sorry, having a wire problem here. Should have hired a camera operator maybe. So, mons, right there. This structure is the clitoris. Labia minor, labia major, urethra, right there, vagina, right there. Maybe a little more close-up on this model would help. So, once again, stick with me. The mons, pubic symphysis, clitoris, right there, corpus cavernosum tissue, labia minora, labia majora. We'd have a little corpus spongiosum under this. I just say that for your lectures. Getting too lectury, I know, sorry. Urethra to the urinary bladder. Vagina right here. Now notice that the vagina here has rugae in it to allow for expansion of this organ. Rugae in the vagina. Also notice the, compared to males, relatively small urethra right here, which explains partly the reason females will have a higher incidence of UTIs or urinary tract infections. A 3 to 5 centimeter urethra versus a 20 centimeter urethra, a lot less distance for those bacteria to travel to cause an infection of the urinary bladder. Same structures again on this model. So notice they look pretty much the same no matter which model I choose, especially if you use that mons and pubic symphysis to orient you anatomically, you can just count your way backward. So mons, pubic symphysis, clitoris, labia minora, labia majora. There's the urethra, here's the vagina right there leading up to the uterus. Now, what we would call this opening of the urethra right here is the urethral orifice. The opening into or out of the urethra. This spot right here is the vaginal orifice. Same structures, different model. Urethral orifice, vaginal orifice. On another model, notice how similar they all are, really. Urethral orifice, vaginal orifice. So again, mons, pubic symphysis, clitoris, these are anterior structures. They'll orient us on these particular models. Next, we have some structures of the ovary, and this is a pretty nice model of a single ovary. Can't ask you everything from this model, but I can ask you a few things from this model. So let's begin with the two primary sections of the ovary. We have the outside portion, which is the cortex, and then the middle, which is the medulla. Pretty standard for a lot of organs we may see. How do I know the cortex? Well, always look for these little developing follicles. I can see here in yellow, there again. This, of course, very enlarged follicle. Here's the corpus albicans, corpus luteum, for those of you who are studying this in your lecture. But cortex is where the follicles for the oocytes, the egg cells, are located. So this area right here is the cortex of the ovary. This would be the medulla. I can also see on this model pretty nicely ovarian vein in blue, ovarian artery in red. The follicle is the name we give to the cells surrounding an oocyte. So this is a follicle right here. That's an oocyte. And yes, you pronounce both O's. Don't go around saying oocyte, or people will think you're goofy, or at least goofier. This is a follicle. That's an oocyte. Follicle, oocyte. So the follicles during development, during the follicular cycle, ovarian cycle, get larger and larger before ovulation. So here's a follicle, there's a smaller follicle, and so on. I can see very small follicles over here, but notice these two that you can see up here. It's a follicle when it still has an oocyte in the middle of it. Notice this tissue, this grouping of cells here, no oocyte, that's not a follicle. Here's another pretty nice view of an ovary right here. Let me zoom in on this one. This is a model attempting to show us fertilization. So think about that for your lecture. But here's the ovary. Out here in the cortex is where I have all these little bitty follicles. Here's one that has just ruptured. That's ovulation right there. So, and for you lecture buffs, that would be a secondary oocyte frozen at about, what, metaphase 2. But I digress into lecture stuff. So look at the follicle. Right here, here, that tells me this is the cortex of the ovary. This is the medulla, no follicles. Also, as long as we're here, notice two very easy to identify ligaments that help hold the ovary in place. Between the ovary and the uterus, which is what this structure is, I have the ovarian ligament right there. Ovarian ligament, medial. On the lateral side right here, I have the suspensory ligament, which is helping to anchor this ovary in place against the lateral body wall. So suspensory ligament, ovarian ligament. If I just go to this model's other side, I can still see those. Ovarian ligament, suspensory ligament. If I look at one of my sagittal sections, I want you to be careful here because it would be somewhat easy to misidentify things. So I'm trying to give us a camera angle here. So I can see the uterus right here. I can see the fallopian tube right there, ovarian vein, artery, easy enough. And look right here, this structure right there, this is the ovary, this is ovarian ligament. So for the suspensory ligament, we want a nice, I can see both sides and the uterus, ovarian and suspensory ligament. This does extend upward and it runs along with, you can see here, the ovarian artery and vein, but they'd actually be much tighter and closer together in a real person. If I come over here to this other sagittal view, I can see the same thing. Ovary, ovarian ligament holding it to the uterine wall externally. Now, as long as I'm here, I can see two other ligaments very nicely in this model. Notice this large sheet of connective tissue actually extends all the way back here. This is what is called the broad ligament. And this structure coming off the uterus and going forward, that's the round ligament. At the risk of insulting you, looking at anatomical models, the broad ligament is called the broad ligament because it's broad. The round ligament is called the round ligament because it's round. So round ligament, ovarian ligament, broad ligament. I can also see red ovarian artery, blue ovarian vein here in this one. Let's take a look at just one other view. So looking at this sagittal view, which we did see before, the uterus right here, urinary bladder right there, broad ligament, round ligament. Let me zoom in a little bit for you. Notice the ovary here and ovarian ligament right there. Don't confuse it with the fallopian or uterine tube, we sometimes call that. Watch this fallopian tube run around and end in these finger-like projections we call fimbriae. The ovarian ligament just goes from the uterus to the ovary. Coming down, notice the ovarian vein and artery right there, and then again, broad ligament right there. So a few of the ligaments associated with the female reproductive system. What we're looking at here is sort of a straight-on view of a uterus with the cervix and vagina right here. I can see the ovary with the ovarian and suspensory ligaments. Yes, 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 we know all that stuff. It's great. Well, let's talk about this thing right here. This I previously called the fallopian tube. That is the most common name. Also called a uterine tube, sometimes called a uterine horn. Your lab manual says uterine tube, so listen up. On your quiz, on your practical, I will include both names, fallopian tube and uterine tube. They're the same, but fallopian tube is so much more commonly used that I will include both of them. So if the answer is uterine tube, it'll say uterine tube / fallopian tube, same thing. So I'll include both names, so don't worry about which one you memorize there. If we follow this fallopian tube all the way out to the end, we see those, what I previously mentioned, those finger-like fimbriae that sort of drape over this ovary. I can see them over here too. Many people think anatomically that the fallopian tube is continuous with the ovary. It's not. The fimbriae rest on top of the ovary, but you could actually just move them away. They aren't physically connected. It's these fimbriae you learn about in lecture that will move, creating a small current to help draw in the ovulated oocyte and its surrounding cells into the fallopian tube where fertilization would typically happen. Now, I like this particular model for a couple reasons as we look at the uterus. First, I can see the 3 layers of the uterus pretty well. They are, from outside in, perimetrium, all this smooth muscle here, myometrium, and then this one, very thickened endometrium right here. But I can see the color difference tells me which layer I have. So I've got myo, endometrium right here on this model. So in this model, very easy to see. No problems at all. In fact, in the endometrium, this is an implanted embryo right here. So I can see that embryo implanted in the endometrium. A couple other features of this model that I particularly like. The cervix. So when we see the cervix, which is this structure right here, now I'm not talking about this white material which is supposed to represent for us a seminal plug that prevents multiple fertilizations. No, don't picture that thing here. Just look at this muscular structure right here. This is the cervix. Because this one has what we will call a seminal plug in it, I can see that the cervix is actually a tunnel with a doorway right here and a doorway right there at either end of this. This one is the external os, external doorway of the cervix. This, imagine a round opening right there. This is the internal os. So external os, internal os. I'll try to show you that on a few other models, but it doesn't show up as well as it does on this one in those other models. And we do have very nicely right here, look at this, this is the fornix. So this is the ring. So that cervix, if you were actually to see it looking in the vagina, looks sort of like a donut or a bagel. And this ring that goes all the way around, which we see as these gouges here in the model, that's the fornix. These structures become important because if a person has a pap smear done, they're looking for tumors, you might describe where it is. Is it in the fornix area? Is it at the external os? Where is this particular thing that we're looking at? Before we leave this model, let me point out one other thing to you related again to that uterine tube. So just for review, because it's fun. Ovary, ovarian ligament, suspensory ligament, follicles here in the cortex, fallopian or uterine tube, fimbriae, and this region right here just inside the fimbriae, this is called the infundibulum of the fallopian tube. If I saw it externally here, it would be this region just before I get to the fimbriae. Infundibulum, fimbriae, like that. Now let's look at it in a sagittal section. So I look at this sagittal section right here. I can see the vagina, the cervix right here. This whole thing is the cervix. Fornix right there and there. The problem is I have an external os, but it's pretty tough to see the internal os, which would be right there. So external os, the external opening of the cervix, internal os, the internal opening of the cervix. Looking at this sagittal section, we have a little bit of a problem. Great model representation of the vagina here, but look what accidentally happened in our cervix. This is where they put a receiver for the other half of the model. So the cervix here, I can see one fornix on one side right there. I can see a fornix, but other than that, it's a little messed up, but I can see nicely the three layers of my uterine wall. Perimetrium, myometrium, endometrium, right there. Let's look at the neighbor right here. Zooming in a little bit. Vagina, fornix. Whole structure here is the cervix. Try to imagine it in 3 dimensions. External os. And say just sort of, where's the internal os supposed to be? It's supposed to be here or supposed to be there? It's hard to tell unless this uterus was vertical or tented is the term some people in the uterine biz use. And as long as we're here, just another view, fallopian tube, fimbriae, infundibulum. Now we come back to this frontal view of the uterus because this one shows us best a couple structures we still have to hit to complete our female reproductive anatomy. Remember, the dome-shaped top of an organ is called a what? Fundus. This is the fundus of the uterus. This is the uterine cavity. And this is the body of the uterus. So imagine the uterus as having maybe 3 sections, is the way most people will think of it. The cervix, right here between my finger and my thumb. The fundus, right here between my finger and my thumb. And the body, right here. So if we go from the internal os up to the fundus, this region right here is all the body of the uterus. And of course, the spot in the middle is the uterine cavity. And just to be a little lecture-y for you, because we will see this in the histology as well, notice the thickness of the myometrium. This uterus is very much a muscular organ. Look at it here in this sagittal section. So a very thick bunch of smooth muscle right here in this myometrium, having receptors for that hormone oxytocin. Think about it when you have your lectures. So make sure you go over these. I believe I've hit all the anatomical structures on the models. Remember, any of these that I show you here in the practice section or excuse me, here in the instructional section or in the practice section, totally fair game for your quiz. Bunch of good reproductive models, but they all show essentially the same things the same way, just some slight color differences. I just pulled out one other female reproductive model for fun to show you a couple things. First, just for lecture, if we were talking about the development of a follicle, so see the follicle, developing follicle. Now we're getting to a gravid or Graafian follicle. There's ovulation, corpus luteum, corpus albicans. Just for lecture. What I wanted to show you here for lab, look in the lower right section, is just a frontal view of this broad ligament. So there's the ovarian ligament, broad ligament. So maybe that gives you an idea where that name comes from. Here's the fundus, body, cervix, right there. But I just wanted to give you a nice big view of this broad ligament helping to anchor that uterus in place inside the abdominal pelvic cavity. So now we'll take a look at male reproductive anatomy using similar models to those that we saw on the female side. Mostly sagittal sections, some that come apart, some that are already apart, but only about, a little more than half as many structures to learn in male reproductive anatomy. And I won't go through these in the order they're laid out in your lab manual on page 3, because I think it will make a little more sense to start with the gonads, the testes here. So as you probably have learned or will learn in your lecture, we have external male gonads, we humans. So this is a testis right here outside the body cavity, has already descended in this adult male, and I can see a few structures here like the scrotum, the sac of skin that surrounds the testes. I can see the outer surface of this testicle or testis, either one's okay. Notice how it's white here. This is the tunica albuginea. Look for that one on the right-hand side. The outer surface, the white tunic, the white coat, the tunica albuginea right here. So scrotum, tunica albuginea, the organ is the testis. I can see all these branches of the testicular artery coming down and testicular vein going up. Let's look at it in another model, same structures. Scrotum, very easy to discern here. Tunica albuginea is the surface. The organ is the testis. Testicular arteries, testicular veins, pretty easy, I think. Another model right here, scrotum, tunica albuginea, testicular artery and vein. And this frontal section that I have, maybe this is even a little easier to see. So notice the scrotum right here, tunica albuginea, testicular artery, and vein. One more view of the same exact structures. So here we are again with the scrotum, sac of skin, tunica albuginea, and very nice testicular artery, testicular vein going up. Now, associated with these structures here in the scrotum, we can continue working our way up, essentially following the pathway that sperm cells would when they were released. So notice this sort of C-shaped structure sitting on top of the testis. That thing is the epididymis. The developing spermatids finish their formation here, waiting to be released into this tube, which is called the vas deferens. So, epididymis and vas deferens. Now, you may also hear that tube called the ductus deferens, which is a slightly more formal terminology. So just like we had the female fallopian tube, uterine tube, vas deferens, much more common, ductus deferens, a little more formal. So we will see both of them on our quiz and our practical, everyone. I'll write both names down. But notice this tube going up, follow it, in front of the pubic bone, up and over the urinary bladder. This tube is the vas deferens. So it's quite a long tube. Let's look at it in a couple other models. So right here we see again that epididymis can be easily palpated, sort of a spongy structure on top of each testis. And then a little U-turn down here that's called the tail of the epididymis, and then the vas deferens going up. Again, in front of the pubic bone, over the top of the urinary bladder. One more model. I think this one, it might all be even easier to see because of the way they colored it. Here's that epididymis, vas deferens going up. Follow along with me, in front of the pubic bone, up and over the urinary bladder. That's the vas deferens or the ductus deferens. Now you will also see a term here, it's at the bottom left of the column of anatomical structures, called the spermatic cord. Many students will call this the spermatic cord. No, you're going to miss a question if you do that. The vas deferens is part of the spermatic cord, but this model, no spermatic cord visible. This one, no spermatic cord visible. This one over here, no spermatic cord. All I can see is the vas deferens. That's not the same thing as the spermatic cord, that's just part of the spermatic cord. It would be similar to this analogy. And those of you in my lectures, you know I love a good analogy. What would represent a class? Me standing in front of an empty room and talking. Is that a college class? No, that's just me talking. The class would need me and you, some students, listening to the lecture. That would be a class. This is just one part of the spermatic cord. So the spermatic cord would be the vas deferens, testicular artery, testicular vein, testicular nerve, connective tissue and muscle that all runs up here. This is only a vas deferens and a little hint of testicular artery there. Look at these two models right here. Let's look at this frontal view first. Let me zoom in just a little bit. So you can easily see the testis and the epididymis, but then going up, do I see just an isolated vas deferens? No, I see testicular artery, testicular vein. This is a spermatic cord right here. The vas deferens, I can see right there, is just part of it. Spermatic cord is inclusive of several anatomical structures. Look at this one. testis, epididymis, this is a spermatic cord because it's not just the vas deferens. Notice it comes up, goes over the pubic bone and back. This is actually a very anterior structure, this spermatic cord. If you find a pubic symphysis and go over, 1.5 inches, 2 inches, you can palpate a spermatic cord on a person. It's really not that hard. But for it to be a spermatic cord for your quiz or your practical, we would have to include more than only the vas deferens. This is just vas deferens. It is not the spermatic cord. Associated with that, I want you to notice in your lab manual, you have it listed about the third one down, the inguinal canal. The inguinal canal. So I'm going to come back over here to this frontal view. The inguinal canal is the tunnel that these spermatic cords run through to get into the body cavity. So this tunnel right here is the inguinal canal. Imagine someone, putting their hands, say, in their front pants pocket. Their index fingers would sort of go right over the top of the inguinal canals. So the inguinal canal is a tunnel that the spermatic cord runs in. This anatomical structure is the spermatic cord going through the inguinal canal. Be careful here. Got to have more than one thing for it to be a spermatic cord. Can't have just that vas deferens like we have over here. Not a spermatic cord. That's the vas deferens. So continuing on, I want you to follow along with me. As this vas deferens goes up and over the top of the urinary bladder, which I can see right here, I want you to follow its path and see where it goes. Now it passes the first of 3 what are called accessory reproductive glands. Here's the first one. See the vas deferens coming by? This gland right here is one of the 2 seminal vesicles. This is a seminal vesicle right there. Continuing on, we go past this prostate gland. Do not say prostrate. That means to lay down on your stomach. This is the prostate gland, the second accessory gland. I can see it if I remove the half of this model right here, and let me zoom in. So this red structure right here is the prostate gland. Notice that the urethra runs right through the thing. Urinary bladder, urethra. This is why if a person has prostatic hyperplasia or a prostate tumor and large prostate gland, you could plug this urethra, have urinary problems. Notice what they try to represent on this model is little diagonal tube right here is where the vas deferens, and this tube would be on each side, comes through the prostate gland to join with the urethra. This right here where my probe is called the ejaculatory duct. And say that again, ejaculatory duct. This is the urethra right here, the urine tube. For human males, the urine tube or urinary tube is continuous with the reproductive tube. They're the same. We don't have 2 separate tubes exiting the body as females do with the urethra and the vagina, not even the same tube. In males, the urethra is the reproductive tube. Let's keep looking at the other models just so you can see the different views that we have of the seminal vesicle and the prostate gland. So notice right here where my finger is, this is the vas deferens, seminal vesicle, prostate gland just anterior to the rectum. You can see it there. If I pull this model apart, I can see urinary bladder, urethra. Notice the ejaculatory duct right there. That's the seminal vesicle. Now I'm looking at from top and behind, see the vas deferens. Let's keep looking. I'm then moving some models around here. Vas deferens, there's the seminal vesicle, there's the prostate gland. If I remove this half, very nicely done. Ejaculatory duct right there, and the urethra going through. There again is the prostate gland. You have two seminal vesicles in a male, but only one prostate gland. This next sagittal model, let me zoom out a little bit, just a little. So I can see at the top of my image, let me reposition just a little bit. Here comes this vas deferens, number 5 right there, seminal vesicle, ejaculatory duct, prostate gland. One more, final view, an almost identical model here except for the colors. Vas deferens, seminal vesicle, ejaculatory duct, prostate gland. Now this is the pathway sperm cells would be following. Peristalsis all the way up here, this is a little lecture for you, and then they don't actually start swimming until they get over here to the ejaculatory duct. These glands add products, they're accessory to the reproductive plumbing here. Seminal vesicle, prostate gland. Now I said there were 3 accessory glands to know. Seminal vesicle is the first one that we pass. Prostate is the second one. We actually go right through it. And the third one, I can see right here, is the bulbourethral gland. Look at that one in your lab manual. Bulbourethral gland right there. It has a little duct, releases its product right here into the urethra. Seminal vesicle, prostate gland, right at the base of the urinary bladder, bulbourethral gland. I say this for the future nursing people. Sometimes, especially in nursing biz, is still known as its old name, the Cowper's gland. So you might see that one. Bulbourethral is better. Bulbous adds pre-ejaculatory fluid to that urethra. 1, seminal vesicle. 2, prostate gland. 3, bulbourethral gland. Let's look at them again. This model almost identical to the one you just saw. The accessory glands, seminal vesicle, prostate gland, bulbourethral gland. If we look at this sagittal section right here, can't see a seminal vesicle from this view. I can see that great ejaculatory duct. Prostate, can't really see a bulbourethral gland from this side. Doesn't really have one. Now, if I was to attempt to put him back together like this, I can see now a pretty decent seminal vesicle, a nice prostate gland, but not really a bulbourethral gland on this model. Same thing is true on this last one. I've got a prostate gland, but not much in the way of a bulbourethral gland here. So those first few models showed it, these others don't. Not a big surprise when you learn in lecture that bulbourethral gland does not add that much as a percentage of total semen volume. You know, generally speaking, you know, about 5% or so, maybe even less. But let's take a look in the sagittal view at the entirety of the urethra. Because you notice in your lab manual, on the right-hand side, the urethra is broken into 3 different areas and an orifice. So follow the urethra with me from the urinary bladder all the way out of the penis. So it's pretty long. Could be as long as, 20 centimeters or so. So it's a pretty long tube in men. The first section of the urethra that you have to know the name of is the prostatic urethra. That's the urethra when it runs through the prostate gland. So from here to here is the prostatic urethra. The penile urethra is the urethra as it runs through the root and the shaft of the penis. From here to here. That's pretty easy. This small section right here, where the urethra passes through this pelvic floor musculature that you see right here, just this little segment right there, that's called the membranous urethra. So in order, prostatic urethra, membranous urethra, and then see this part of the root, or sometimes called the crus of the penis. Right when I get there, now it's penile urethra the rest of the way. Let's look at a couple other models to see the same exact thing. Prostatic urethra, I can see pretty easily. Penile urethra, I can see pretty easily. Membranous urethra, can't see it at all. It's buried in there. Come over here to this model. Very good prostatic urethra. The membranous urethra here is pretty weak, but the penile urethra, very easy to see. So if you want to see the membranous urethra, you can look for it about where this bulbourethral gland is. Look at this connective tissue streaming across. But a model like this one is best to show me that membranous urethra, just this small little section right there. Prostatic, membranous, penile urethra. And that takes us out to the what? External urethral orifice, the urine hole. The hole out of which both urine and semen would exit the body. External urethral orifice. External urethral orifice. I don't think you have too much trouble with that one. Only a few other structures to hit to round out our discussion of the male reproductive anatomical structures that you're responsible for. And first, I have a limitation because of where I'm located. In this entire lab, I only have one model that shows seminiferous tubules. Those tubules inside the testis where the sperm cells are developing. This will make sense in your lecture. Remember the Nurse cells or sustentacular cells, seminiferous tubules. And this is the only model that shows them when I remove half of it for sagittal section. See these little tubes right here cut in section right there? These are seminiferous tubules. This is the only model I have that shows those all over in here. All this white is representing seminiferous tubules for us. The other structures we have are penile structures, or structures of the penis. Now, I will start with this model right here because of the way it is colorized. I want you to notice the red and sort of light gray tissue that we see here in the shaft of the penis. So we have this gray tissue, which is corpora cavernosum tissue, or corpora cavernosa, because there are two of them. When we do the histology, this will represent the eyes of the face we see. This is one of the erectile structures. We have three. In men, there are two bodies of what's called corpora cavernosa. One, which is red, corpus spongiosum. That's all this red stuff. These are both tissues that become engorged with blood, form an erection. Which one do you think is spongier? Well, duh, the spongiosum. You would see more elastin fibers in that tissue. It makes perfect sense when you look at this. What's this structure? This is the penile urethra, isn't it? Which goes right through the corpus spongiosum tissue. If this tissue became as rigid, as hard as corpora cavernosum did, say this erectile body right here, or the clitoris in women, if it got that rigid, it would pinch off the urethra, causing some plumbing problems. So spongiosum is erectile, but it doesn't get as rigid or as hard as this corpora cavernosa right here. Also notice that the corpus spongiosum fans out at its end, forming the glands, or the head of the penis. Here in anatomy class, make sure you say glands penis. So it fans out, forming the glands of the penis. So in red, corpus spongiosum. In gray, corpus cavernosum. If I look at the next model over, I can see a similar idea right here. So look at the shaft of the penis, corpus cavernosum here. This model is actually trying to show us these vascular chambers that we have in the tissue. Corpus cavernosum, corpus spongiosum with the urethra through it, forming the head or glands of the penis right there. Next model over. Only slightly more difficult because they colored it essentially the same. But I can see all of this corpus spongiosum. We only have one of those. Corpus cavernosum right here. Both sexes have both of these tissues. A little bit of corpus spongiosum under the labia, and the clitoris is corpus cavernosum. Dorsal side of the penis, two of them. Ventral side of the penis, one spongiosum. And I think that is every structure that we needed to hit. Now let's start looking at some reproductive slides. As our last section of A&P Lab, you and I together, and I know what you're saying. You're saying, Dwayne, I wish you could teach me lab forever, and I wish I could teach you lab forever, but unfortunately, we can't go forever. It just seems like it. We actually have to wrap it up at some point. So here we are looking at the first micrograph in the histology of the reproductive system section of your lab. This is a testis, one of the testes, characterized by a whole bunch of almost countless tubules, most of which are very round. Not all, few are oblong here, depends on the section and the way the slide and tissue is cut. But these things are seminiferous tubules. Do not confuse them with follicles in a thyroid gland. They're not filled with colloid. It's kind of tough to tell exactly what that is, but it's definitely not colloid. Again, these are seminiferous tubules, the inside of which always looks very fuzzy and sort of indistinguishable. It's hard to tell what's going on here in the center. That's because literally thousands and thousands of spermatids are breaking off the inside surface of these tubules as they're being formed amongst those nurse cells that you hear about in your lecture. So what we have are seminiferous tubules. That's these relatively round structures. The spermatozoa, the developing spermatids, are in the center of these seminiferous tubules. That's why they look so fuzzy here. We also see, and look closely, here, 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 these triangular masses of cells that live between the tubules. These things are called interstitial cells. These are the cells that actually produce testosterone. So the seminiferous tubule developing our gametes, our spermatozoa, which are in the middle, and all these little groups of cells out here between the tubes are interstitial cells. Now, I'm going to roll right into the next slide, which is the epididymis, because I can easily get, think about it, a micrograph that shows both, because the epididymis sits on top of the testis like a little cap. So if I simply move up, this is epididymis. And I know what you will say, how am I supposed to tell that from the testis that I just saw below? It does look a little different, doesn't it? Let me point out a couple of these features for you. Certainly a collection of tubes with spermatozoa inside the tubes, the gametes. Easy enough to detect. But notice, first, the wall of the tube is much thinner in the epididymis. But even more importantly, notice right here, there's a gap, typically of white, empty space between the wall of the tube and where the spermatozoans are. That's because here in the epididymis, I'm not forming the spermatids. They're not breaking off the inside surface. They've already done that. They're just being stored here and finishing their development, growing a flagellum and so on. So there's always a little gap I see here between the wall and the spermatozoa. Also, I don't notice groupings of interstitial cells. Another secondary thing, epididymis, these tend to be a little more elongated, but that's not a dead giveaway. The thing to look for are these white gaps between the wall and the spermatozoan. I see them in the epididymis. I do not in the testis. So name of this organ, testis. Seminiferous tubules, interstitial cells, spermatozoans. Name of this organ, epididymis, spermatozoa, right there. Watch it several times. I think you'll get the hang of it. Okay, what we're looking at here is a micrograph of a penis. The next slide in our histology section. Now what you may notice here is I actually had to capture a couple micrographs, then post them in a Word document so that I could make it small enough so you could see it. My microscope here is too powerful, magnifies it too much, so we wouldn't be able to see it all at once. But I'm still trying to give you the best image I can. So let's take a look at this slide. What can I ask you? Name the organ. Penis. And have you noticed that it looks like a face? Everybody notices that. 2 eyes, lips, and a mouth. People call this the bug face, the face, the monkey face. I hear different face references here all the time, and it does look like a face. The 2 eyes that I see are the corpus cavernosum tissue. Corpus cavernosa, there are 2 of them. Corpus spongiosum is the lips on this face, and the urethra is the mouth. So these 3 cylinders, tubes of erectile tissue in the penis, the spongiosum, of course, around the urethra has more elastin, does not get quite as rigid as the corpus cavernosa here, corpora cavernosa or corpus cavernosum, if you're just looking at one of them. You'd find the same tissue with all these vascular chambers that becomes engorged with blood as the clitoris in women, and corpus spongiosum just under the labia on each side of the opening to the vagina or the vaginal orifice. And here's that urethra again. Now the last thing is this tissue that we have surrounding these structures called tunica albuginea, again, sort of a whitish tissue. So tunica albuginea, corpora cavernosa, corpus spongiosum, urethra. In this penis, I called up another one, I got another one here for you. Again, notice the face, corpora cavernosa, tunica albuginea, corpus spongiosum, and urethra. This probably the easiest histology slide of the set, even easier than the thyroid gland, because there isn't anything else that looks like this one. So, a penis. Okay, next we're going to take a look at a few different ovary slides. Slides of an ovary. Now, we're talking about what looks essentially like a solid organ. So it has a cortex and a medulla for sure. This one's not magnified that much, but I want you to notice out here in the cortex, I can see all these little round structures. These are follicles. Each one of those is a follicle. And it's in the cortex where all the follicles live. In the medulla, I don't see as many follicles. And as long as we're here looking at this particular ovary, I want you to focus your attention right here on this strange looking follicle that we see right there. And let me zoom in on it a little bit. This follicle right here. This is a picture-perfect view of what's called a tertiary follicle, or a gravid follicle, or a Graafian follicle. You hear those names. This is a follicle that is ready to ovulate. So it gets this sort of almost hollow-looking appearance, and right in the middle here, you can see it just faintly staining. That is the oocyte in the middle of this follicle. If you look over here, I can see an oocyte in the middle of this follicle. But this one, this appearance right here, that's exactly what you want to look for. That is a tertiary follicle, ready to ovulate. Let's look at a couple other ovaries, maybe for a slightly different image. So here's another ovary that has stained a little more darkly, but I can still see follicles out here in the cortex. There are many, many, many follicles here, hundreds and thousands of follicles, but only a few of them are big enough that I can actually see at this magnification, but I can definitely see them out here in the cortex. This is the medulla that doesn't have as many apparent follicles in it. This ovary is a nice one for us to look at, however, because it has this structure right here. Notice this. This is a follicle with no oocyte in it. The oocyte is gone. Was right here. This is what's called a corpus luteum. This is the follicle after it has released the oocyte, after it has ovulated. Right out there in the cortex. Corpus luteum. Let me see if I can find a different one. So this is a nice follicle right here because I can see, look at all these follicles out here. There's a nice ovary. Look at all those follicles. They're everywhere. Now, I can tell by looking, this is obviously not a human ovary. Why? Because I see a bunch of corpus luteums here, and in a human ovary you would typically only see one. You certainly wouldn't see 8. This is from a rabbit or a mouse or some other mammal that has multiple births typically, but not a human ovary. But I can definitely see a cortex right here to look at all those follicles. Look closely. Let me jump up in magnification one time for you. Maybe that will help. See all these? Every single one of them is a follicle with an oocyte in the center of it. All out here in the cortex. So look for multiple follicles in the cortex of what? An ovary. And pay particular attention to that tertiary follicle. It has that classic look that we want to see. So cortex, medulla, follicles, I can see here. What's the name of the organ? Ovary. What we're looking at here is a nice slide of a uterus. This is a uterus slide, the next one in your list. And what I want you to notice are these structures right here. To me, they're sort of reminiscent, if you can remember back to Lab 6, of intestinal glands. But these are not villi. This is not a small intestine. This is the endometrium right here. These are uterine glands, we call those. So you see those in the endometrium of the organ. Sometimes they're called endometrial glands. For us, we'll say uterine glands right here in the endometrium. And you can see the tissue change right over here into all this smooth muscle. That, of course, is the myometrium. Let me move down a little bit so I can see this endometrium right here with these uterine glands in it. Very characteristic. Nothing else really looks like that. And then I get into all this smooth muscle that is the myometrium. So endometrium with the glands in it. Myometrium is just smooth muscle. So if I scroll over here to where I can see both nicely. So again, endometrium, uterine glands, myometrium. What we're looking at here, and we're getting right down to it, people, last few slides, is an inactive mammary gland. How do I recognize this compared to all these other histological slides that you're showing me, you say? Well, first, I want you to notice adipose cells. Remember that the human mammary gland has associated adipose, a gland surrounded by fat or fat surrounding a gland, however you want to put it. And then look at these clusters of dark structures. These are actually lactiferous sinuses and ducts, but everyone, they are deflated. There's nothing in them. So always, and you will always, in an inactive mammary gland, see adipose cells. So look for that. You see the adipose cells, some muscle, some glands that are not filled, inactive mammary gland. If I throw up an active mammary gland, I think you will see it looks quite different. So now look at all these tubes that are now filled with milk, breast milk. Do not confuse those with adipose cells, because notice the darkly staining masses of tissue here. So now I can barely see any adipose cells for all the inflated ducts and sinuses here. So look at this thing. Here's a perfect spot right here. All expanded and filled with milk, active mammary gland. And everyone, that's all I can ask you. Is this an active or inactive mammary gland? Active, all the tubes are filled. Inactive, I can't see them much at all, but I will see the adipose. Okay, everybody, thus endeth the lab. So that takes us out of new information for 224 lab. Hopefully you enjoyed it a little bit this semester. It's a lot of work. Let's say enjoyed it as much as you possibly can, given the circumstances and the delivery method. So I made the videos as well as I could. I hope you studied them as well as you could. Good luck in your future endeavors for those of you who are not in my lectures, because you won't see me anymore. And guess what? I can't even see you. So all we have left is a quiz and then your practical. So your quiz over lab 8, then the practical covering labs 5, 6, 7, and 8, those 4. Respiratory system through the reproductive system. So watch the schedule, stay ready, look at those practice videos, and good luck on the quiz, good luck on the practical, and hey, good luck on your final exams. Why not? It never hurts. Thanks a lot, people.